Hi, friends. Marcy Schomborn here, and I am so excited to be here today because I have a special guest, my friend, Ashlee Hankins. And she is an independent RN patient advocate and birth doula. Welcome, Ashlee. And can you tell us what a doula is?
Yes, thank you, Marcy. Thank you so much for having me. I'm so excited to be here. So, a birth doula is somebody that walks alongside a pregnant woman through prenatally, through her entire birth, and then postnatally as well. Birth doula specifically kind of sticks in that zone, but you even have postpartum doulas that will come for multiple visits. But we do prenatal visits where we talk about like what are your goals, what are your options, lots of education. And then we talk about a lot of holistic ways to prepare for the birth that you're looking for. And then from the moment the mom wants me there, I am at that birth by her side. Most of the time, I'll be honest, the dads kind of get in there and I'm just supporting them and stepping in when I'm needed. A lot of the preparation's done prenatally. And it's really awesome to see them thrive together because I get to do the dirty work. I get to grab the water bottle and make sure it's filled up and make sure, hey, don't forget to go to the bathroom. He gets to actually be the support he's looking for. So he doesn't have to wear those two hats, which is really nice. And then postnatally, I make sure that we are good to go before I leave the delivery room, that everybody's kind of settled, comfortable, and then I see them at their home or wherever afterwards to check on breastfeeding and baby and mom and make sure everyone's doing well. So kind of like your personal assistant through prenatal and birth and beyond.
I love that. And how
Yeah.
common is this practice?
I would say it's becoming a lot more common where I've lived in many different states. Family. So you see it larger in certain areas. Georgia, where I was at before here, there was probably more doulas, but we just had a larger population. Colorado is very popular to have doula work and those more holistic births than just the typical hospital birth that we see. And it's becoming more and more popular. I would say in the local Cheyenne area, I know of at least 5 or 6 doulas out here that are working. So, yeah, it's getting exciting because it's definitely growing.
I love that. And for everybody watching, I will put Ashlee's contact information underneath this video. She is local to
Yeah.
Cheyenne. And so
Yes.
if you want to reach out to her, you will be able to do that. And so I've got a lot of questions and I'm excited. So you started your career as a labor and delivery nurse. And can you tell us about that experience and what it taught you about supporting women?
Yes. So, as a labor and delivery nurse, well, I started 9 years ago as a registered nurse. I started in pediatrics, quickly transferred over to mother baby. So, I started more on the postpartum care side. And then went to labor and delivery. And because of my husband's military career, I had the benefit of hospitals all the time, which wasn't so fun because I started on night shift again every time. But it was awesome because I got to see how it can be done different everywhere. There are so many different ways to do this. It's not a one size fits all. And then as far as supporting women, what I noticed really towards the end of my career was how many women came to the hospital with these expectations and their ideas around their birth and what it was going to be like, and very little preparation. They were not prepared. And even to the point of, I wouldn't say they were misled intentionally, but definitely misled by providers. My heart broke for them. And so I would do my best. I loved being in the room, hands on with these mamas, trying to get them to their goal. But it's really hard to do that in the throes of labor.
Yeah.
So that's kind of what it taught me that they just need more support. And
Okay.
as a labor and delivery nurse, you're balancing multiple patients. I was at very busy hospitals. There's just no way that a labor and delivery nurse can give that one-on-one care that a mom really needs in labor.
Okay. Yeah, understood. And and this is something you and I can talk about in another talk is how they're not prepared even with nutrition. You
No.
know, that's my jam. So that's where
Yes.
everything I understand. So I'm learning from you today, and I'm really thrilled about this. So, what inspired you to transition from traditional nursing to becoming a doula and patient advocate?
Oh man. So when I was a labor and delivery nurse, and I'm still a registered nurse, I keep my license active. I saw so many injustices in the hospital, and it infuriated me, if I'm being honest. The amount of times that we walked into a room and said, we're going to do this. And I am guilty of that too. You know, we know best. This is how we do things. And then I started seeing, you know, these moms coming in labor and they're doing great, and we start messing with them and things start going awry. And I'm just like, what are we doing? This is crazy. So I have always had a very holistic mindset. And so I started kind of diving down that rabbit hole and realizing that a lot of what we were doing wasn't helping, it was hurting. And it's not intentional, it's a this is how we've always done it
Yeah.
mindset.
It's the system.
It is. It is. And if you start asking questions like, for example, where did Friedman's labor curve come from and why are we still using it if it came from the 50s? And it's not a one size fits all. And not every woman's labor is going to go that direction, you know, but it's a hospital system. So we are there to get them in, have a baby, and roll the room over. And especially where I was at, where it's really, really busy. So the faster we turn that room over, the more money the hospital makes. And so my desire to support women in a different aspect felt true to my beliefs. I was starting to just not align with what I was being asked to do in the hospital. And so that's kind of, make sure I cover everything. That's kind of what made me transition to the doula side. The patient advocate side really came from reading more about my role as a doula and realizing that I wasn't utilizing all my education and experience. So I started researching deeply what role actually fits my knowledge. Independent RN patient advocate. So hospitals have patient advocates. Their goal really is to smooth things over when there's an issue between a patient and a doctor. They're not there dedicated to the patient, they're owned by the hospital. So it's preventing litigation. I am employed by my client. My number one priority is that person, their wishes, their baby, their well being. So I can speak up in the room. I can review medical records. I can suggest alternatives based on studies I might have. I can really dive deep into that medical aspect. So that's kind of where I felt like patients were lacking. They're not given all their choices. They're given a very direct, this is what we recommend, and you should basically do that. And I would like to be there to offer them all their choices. So
Okay,
that's my
so
plan.
you're doing this either at home or at a hospital with them.
Correct. So as a birth doula, there's kind of two avenues. As a birth doula, I have some clients who are very low medical needs. Maybe they're having a home birth, or maybe they're having a birth center birth, or even a hospital birth, but they have no complications. They're run of the mill, everything is going great. Okay, great. I support them as a birth doula. If we're in the hospital or in a situation where I need to put on that advocate hat a little more, I will. I never don't have that role capacity. But then I have my clients who have very high medical needs. They're being followed by MFM. Maybe they have some anomaly with their baby, or they have, you know, preeclampsia or gestational diabetes. And that's where I can really step in as an advocate. I can attend appointments. I can attend appointments in person or virtually. I can review medical records, and I can help them when they're feeling really kind of pushed around by the system, and not and give them like all the information, all their options. I'm never giving medical advice, but I'm giving every ounce of information they need to make their own decisions.
Wow, that I think that's amazing. And and I can only think about my own personal experiences, which happened over 30 years ago. And I have stories there too, but looking back, I think that it went well. Three different types of births. Like my first one, he wouldn't crown, ended up doing a spinal, and and you and I could probably unpack that, and they probably could
Yeah,
have done other things, right?
yeah,
Um, And then my second one, I went in planning to have an epidural. That was pretty easy. And then my third one, I had her in 20 minutes and didn't even have time for the epidural. And I was screaming for my epidural,
Yeah.
but clearly didn't need it.
Yeah.
And I do think I recovered faster from that one, and so did she.
Yeah.
And so and here's the thing too that I think is beautiful about what you're doing is this is an experience a woman and hopefully a couple is never going to forget a moment of it. I know every moment of 3 deliveries.
Yeah,
That was
exactly.
decades ago. I
Yeah.
don't know what I did last week sometimes.
Yeah.
So I really have to give you kudos because this is such a special time that I think may not always be able to be celebrated as much as it should be. So,
Exactly.
so I just
Yeah.
wanted to say that.
Yeah.
But so were there specific? Let's see. We did this one. So, what gaps did you see in maternal care that led you to create a more holistic, woman-centered model of support?
I think it was just basically that one size fits all. Like we're bringing them in, if they're X amount of centimeters, generally speaking, we're admitting, and it's not options. It's not options around their choices. It's a lot of directing. Now, am I going to say that there were never providers that I worked with that gave options? That's not true. There are amazing providers out there, but the majority are giving direction. And it's whether it be their comfort level
Yeah,
or this is what we've always done. It's just that's not informed consent, though. Unfortunately, I can sit there all day and look at a client and think in my head, this is what I would do. But that's not my job. My job is not to tell her what I would do. My job is to give her
right.
all the information so she can make that decision for herself. And
Yeah.
like you said, this translates directly into motherhood. And
Mhm.
that's the biggest difference that I noticed. I too have had 3 birth experiences, and my last was a complete physiological birth, and where I advocated for myself a lot in the OB's office, being over 35. We want to do this test, this additional test. We want to induce you. Just constant. I felt like meddling and I felt fine. I felt like I'm confident that my body is doing what it's supposed to do and my baby feels great. She's moving like crazy. I feel amazing. I'm going to wait. And I just kept saying that over and over. And
Yeah.
I would kind of skip around and I found a provider in the practice. You never know who you get on delivery day. That's how it works out here. But I found a provider in the practice who aligned with that and didn't mess with me. And I just stuck with her. And that's another indicator of how do you know that something's maybe not medically indicated? If one provider suggests it and the other doesn't,
Yeah.
like it's probably optional.
Yeah.
So after I did that and I had this amazing physiological birth where I advocated for myself, my postpartum was completely different. And I felt so empowered as a mom to just follow what felt right for me. And I think when we look at healthcare and the way that we treat these mothers, if we're making all the decisions for them in labor and birth, and we're basically telling them, like, your body needs help, it's not doing what it's supposed to, it's broken all the time, or we know best, how do we expect them to walk into motherhood empowered and confident and filling the role that they were
Yeah.
designed for? We kind of take that away from them. So, those are the gaps that I see. It's an educational gap. It's a one size fits all mentality. And unfortunately, not a lot of people are looking out for the actual client and their baby. They're looking out for maybe the hospital system,
Okay.
or they have different goals. My only goal is for my client's goals, you know? So
Yeah.
my practice aligns with that. So, yeah.
Okay. I love that. And then I have a question as well. Like you alluded to, sometimes it's not always the doctor or the actual patient's doctor that delivers the baby. And I had that happen to me with was it my second? No, actually my first child. And um, I mean, I know they work in the same practice together, but how well do they even know you? What is your take on that? And I know they can't be everywhere at one time. I get that.
Not. Um, I don't like that model of care. I know that it's probably necessary because of the amount of people we have giving birth and the idea that we have to be in a hospital. 98% of births occur in a hospital. So 2% on average occur outside of the hospital. So if you're doing a home birth or maybe a birth center birth, you definitely get more personalized care. Home birth, you're going to have the same home birth midwife throughout your entire prenatal and into your birth and postpartum. So that's probably the most intimate level of care. But the other thing is not everybody fits into that. There, like I would have risked out of a home birth with my first birth. So hospital birth holds a special place for me because you can still be holistic and want that and birth in the hospital. So I don't think it's the best model of care. I have seen many times where providers hardly look at the chart or look at anything up about the patient before they walk in the room.
Yeah.
But I think it's that one size fits all mentality. Like, this is how we do it. I've always done it this way. This is how I'm gonna do it with you, and this is how I'm gonna do it with her next door. Um, yeah, so it's really unfortunate. And that's why having somebody there like myself, or even let's say you don't have access to a patient advocate, have somebody there who's not emotionally invested in the situation. Maybe it's a relative who has a little medical knowledge or is confident, kind of voicing what's going on, and give them the ability to speak for you when you're in the middle of contractions, or if they need to call a hard stop to the room. Because I've seen things where providers are ordering things and I'm like, that wouldn't even work well for this mom. Like she has, X, Y, and Z that's contraindicated with that. So medical errors are a leading cause of death, and
Yeah, they are.
they are. And so when you think about a mom in labor and a husband who's trying to oh man, men, when they can't fix something, right? So their
Yes.
wife's in pain, they can't fix it. They're emotionally not in a good place to
Yeah, yeah,
advocate for you. So
yeah.
having that third party is super effective.
Yeah, and that's, one of the things I do teach my clients about medical errors being a leading cause of death. It's actually the number three cause. And I think it only, if I remember statistics correctly, it's only number three because it's not accurate.
Yeah,
It's probably higher than that. And then, of course, number one is typically heart disease and everything associated with heart disease. But what people don't realize with the heart issues is all the other diseases lead to heart failure.
right.
And so
Yeah,
when we remove all that, then all the iatrogenic, the doctor caused issues come to the top. And
exactly. Yeah.
that can be, we knowledge is empowering when we use it. I don't like to say knowledge is power because often we don't use it, but
Mhm.
when we use it, very empowering. And even one size, like you said, you see so many things that are one size, and that's across all health. I hear that with my health clients as well. Talking to a client yesterday with stage 2 kidney disease, and they want to put you in a box. And what are your other health issues? How old are you? What are your genetics? There's so many factors in all of this. And when the person at the moment isn't even looking at your medical file, that's dangerous.
Right. And just the coordination of care. How many times do we see doctors actually all sitting down to coordinate care on a
Yeah,
patient? That's very uncommon,
very.
but it's super necessary. I mean, you
Yeah,
have all these, your body is a whole being. All
yeah,
these systems work together. So
yeah,
if we're not coordinating our care, how are we doing the best for our client? You're treating, like MFM and the OB and whatever. It's not all aligning because you're just treating a portion of what's happening and you're not
yeah,
treating the whole person. That's where like advocacy in general is very effective. And I eventually would love to just dive into independent RN patient advocacy, period, because I saw it, young with my grandmother. Like
yeah,
she's got all these doctors prescribing all these things, and I'm like, I don't even know that you can take all those together.
yeah.
Or, what's happening over here with this isn't helping this part of your body.
Mhm.
So it is super important to look at the body as a whole and to
Yeah,
have everybody collaborating. The that doesn't happen um,
No,
in our healthcare system. So
no, it really
advocates are
doesn't.
really important. Yeah.
Yeah, no, I agree, and I see it in many different health issues. So why is it so important to you that women feel heard, respected, and empowered during pregnancy, birth, and beyond?
It directly aligned with motherhood. And anybody who's been a mom knows how difficult it is. That first kid, man, they rock you. Like, whoa. And I think what happened to me with my first and what I've seen so many times, time and time again, is when you don't feel like you know what you're doing with pregnancy and labor and then birth, and then you have this human being that you're supposed to take care of, you're constantly searching for somebody else to tell you what to do when it's innately
Yeah,
in you.
yeah,
So when we help moms feel heard and respected and trusted throughout pregnancy and labor and birth, when there's something wrong with their baby, they're going to see it and they will speak up. How
okay.
many times have we people who have been victims of medical error say, I knew something was wrong. They weren't listening to me.
Yeah,
That's just
yeah,
a fault across the medical system, that
yeah,
complacency that we run into. And I'm not saying this to target anybody in the medical system. I'm a nurse myself and I
yeah,
love being a nurse, but we have to break that mold. We have
yeah,
to start listening better and
yeah,
listening to our patients. And I think when we can speak into that and feed into that, and really, I mean, I'm like your biggest cheerleader. I'm telling you over and over again, you were designed for this. Your body is doing this.
yeah,
Why
yeah,
can we? My favorite thing that providers will say is like, we need to induce you for no apparent reason at 39 weeks. And I know what it's on. It's based on the Arrive trial, which we could go down that rabbit hole, but it was a flawed trial. But my biggest question I ask my clients are, if your body has grown a baby, created an organ, fed, nourished, and created a healthy baby, that sounds a little more complex than birthing this baby. So why do
right.
we think all of a sudden we can't do it? So I'm there to really just, everybody needs that, whether it's an advocate or a doula or anybody. You need somebody in your life who's going to say, girl, you got this.
Yeah,
Like,
yeah,
you were made for this. And
yeah,
those maternal instincts you feel, they're right.
yeah,
Listen to that.
yeah.
So, yeah.
No, I love that. And one of the things my clients will hear me tell them is I tell them when they go to their doctor appointments to act like a 3-year-old. And why? Because
Yep.
we don't do that. We hear what they have to say, we take our prescription and we go fill it and we take medication. We don't get to the root, which the doctor may not even know how to do that. But why? We have to advocate. And so that's we need to put on our little 3-year-old hat and
Yeah.
ask questions. But we
Yes.
even need to know the questions to ask. And I'm sure that's where you can come in as well, is if your doctor's telling you this and this is what you're feeling, what's going on, why?
Right.
Why is your doctor
Exactly.
telling you that? So that's very empowering. I love it.
Yeah.
How does your background in nursing influence the way you now support your clients as a doula and advocate?
Yeah. So, and I kind of missed this in an earlier question, so I'll kind of loop back to this. A big reason why I started exploring this advocacy route was in 2021. My brother was hospitalized. He had a massive blood clot and it occluded both pulmonary arteries. So he was getting no blood to his lungs and nothing was oxygenated and no blood was flowing through his body. And he was down for about 20 minutes. And that was in the hospital. He went down in the hospital and he was down for about 20 minutes before they gave a clot busting medication. And so he suffered an anoxic brain injury. And in that time, this is during the height of COVID, we as a family had to fight every inch of everything that was going on, whether it be getting visitation, letting us know before you start a medication on him. He's intubated and not able to make any decisions for himself. You have to tell us before you want to do X, Y, and Z. Making sure that we could be there around the clock because we would be coming in and, things weren't being taken care of that night. He is unable to advocate for himself. And for all we know, he also could have been trapped in this body and can't move, can't talk, can't do anything. Maybe he does know what's going on and maybe he's terrified. So us not being there was unimaginable. And even with my nursing background, I mean, I immediately know, and these are things that I use with my clients all the time. We have to know the chain of command. We have to know if we're not getting the answer that we need or feel that we deserve with the person we're speaking to, who do we go to next? And knowing who to ask for by title and name immediately is very powerful. So immediately asking for that next person up, involving patient advocacy, involving risk management. You're in charge of making sure this hospital doesn't have errors and hospital acquired infections and deaths. So let me tell you how this situation isn't facilitating that. Once you start involving all these people, things change a lot. And I learned a lot of this after he eventually passed, unfortunately.
Sorry, very
Um,
sorry.
yeah, thank you. But it rocked me having my background and having to fight the way that we did. All I could think about was imagine somebody with no medical knowledge in
Yeah,
this situation.
yeah,
I saw it over and over again as we're standing outside his window looking at him, the same person sitting next to me looking at their loved one outside their window days after days. And that just blew my mind.
mm,
Then I walked back into the hospital and I just could not unsee it anymore.
mm.
And I watched just injustice after injustice and people not being told that they could refuse things. There's so much you can refuse. You actually don't have to agree to anything in the
Yeah,
hospital.
yeah,
It's your body. You're
yeah.
hiring them. So sorry, and I probably got way off topic there.
No, I think this is great and people need to hear this.
Yeah, so correct me if I'm wrong, but you asked me how do I integrate holistic practices?
Um, how your background influences the way you now
Yeah,
support your clients. Yeah. So
okay.
and that you
So
stayed, I think you stayed on topic. Yeah.
yeah, so I use all that knowledge that I've gained. Specifically, I look really deeply into the hospital that we're entering or the healthcare, whatever setting I'm entering, and I look at their policies, their procedures, their leadership, who's at the top, who's below them, and I make sure that I have all those tools in my tool belt in case I need them. And then in the room, when it comes to birth, I never want to be a thorn in their side when people are trying to do their job. So I just try to keep my client at the center of the care. But also, like if I know she wants to get in the shower and I can look at the clock and say, I know this nurse is going to need vital signs in 5 minutes, I just go ask them, can you just get a quick set of vitals before I put her in the shower? And they're so grateful for that. Like,
Yeah, yeah,
they're
yeah.
so grateful. So I really try to keep an amicable, great working relationship. And, so far, so good. I haven't had any negative experiences. But I use all my nursing knowledge to equip me for anticipated conversations, anticipated interventions, what the medical team is kind of mulling over in their head. I can usually anticipate that based on my experience and kind of prepare my clients for that as well.
Okay.
And then in like the big emergencies, I remember as a nurse looking at that dad thinking, I wish I could just sit with him and explain to him what's going on right now. And now I get to. Now I get to just sit down
That's
with him.
huge.
Yes, as they're taking care of mom, right now this is what's happening. It's scary and I know it feels really scary, but we're just going to focus on this. She's okay. Whatever I need to do to walk him through and keep him
Yeah.
okay while they're taking care of her. So,
Yeah, no, that's huge. And again, I'm very, very sorry for your loss, but
yeah.
your story makes you good at what you do. Your story and your overall experience from being a nurse to personal experience. And I don't think we can be good at anything if we haven't lived it. And so thank you for
I,
sharing that. I
yeah,
appreciate that. So can you walk us through what it looks like to work with you from prenatal to postpartum?
yes. Okay. So prenatally, the first place, and sorry, I'm going to glance at my notes really quick here because I want to make sure that I cover everything.
That's okay. I've been glancing and I've been taking more notes because I know you and I are going to talk again because
Yes.
I know that there's so much more to this than we're even unpacking today.
Yeah. Okay, so as a birth doula, so like we talked about, kind of two lanes of clients. I'm always wearing both hats, but there are definitely clients that I'm more an advocate for. Or you can hire me just as a patient advocate. So I'll talk about that because that's a little more succinct. If I'm hired as just a patient advocate, not just a patient advocate, but if I'm hired solely for that purpose, I am available for appointments via Zoom or in person. And I'm able to attend whatever appointments you want me attending at. And I'm always in contact with you. I'm looking at medical records, making sure that your goals and what's happening, that you're clear, you're educated, and all your options are being presented to you. So that's kind of the advocacy role prenatally. I can actually attend appointments, which is really wonderful, and review medical records. As a birth doula, you get me for two prenatal appointments. So if I'm doing both for you, those are kind of separate. This is our birth doula appointments, 2 2-hour prenatal appointments. And I really cover in that first 2-hour appointment, I'm getting to know you, getting to know your goals. What baggage might you have? What do we need to unpack from previous experiences? Fears? What are your desires for this birth? All of those things. And then in the second appointment, I'm kind of tailoring that towards what we need to work on. In between, I always send like a ton of resources after the first appointment. I'm always like, sorry, but these are all the things you need. But it's just like, this is what I'd recommend for this, whether it be positive birth stories. Here are some great positive birth stories. I'd love for you to listen to those in your free time to reinforce your body's ability to do this, whatever. So I'm
Mhm.
speaking to what they're needing. And I'm just trying to give them that information. Also, resources. Do we have a nutritional gap? Maybe I'm referring them to you. Do we have joint and pain issues? I'm referring them to chiropractic care. Do they need childbirth education? I don't yet offer that. That's coming. I don't yet offer that, but I'm referring them to some trusted childbirth education resources.
Okay.
And then during the birth, moms usually call me in early labor and I just walk through it with them. How you feeling? What are we doing? Any recommendations I might have? Sometimes they're like, I'm doing great. And I'll just let you know when it gets stronger. Perfect. And then when it's intense and they need that support, I'm right there, whether it be at their house, at the birth center, at the hospital, wherever they may be. And I'm with them throughout the entire birth, which is, as you can tell, is a huge grin on my face, my favorite
Yeah,
part.
yeah,
Um,
yeah,
I love birth. I've always
yeah.
loved birth. And then I stay, make sure everybody's good to go for at least 2 hours postpartum. And then I have one postpartum follow-up visit. If it's an more advocate specific client, I can absolutely be like, let's say you have a baby in the NICU. I can be coming to the NICU with you and
Okay.
making sure, that's something that's like so underestimated, the emotional impact and what you forget. And I noticed that with my brother. I would look back and be like, I don't even remember what that doctor said about this, that, and the other. And that's like my wheelhouse.
Right,
So
right,
I look back and I'm like, I wish we had had somebody who wasn't as emotionally invested as we are.
right.
So for my advocate clients, especially like a NICU stay or an extended hospital stay, I'm always checking in and there if they want me there.
Yeah. And I love that you even, yes, you do grin about this and I know you love birth and it just shows. And, and I'm blessed to know you, your husband, and your beautiful
Yeah.
children. I remember meeting you guys. I remember when you came in with, B, the blanket, your
Yes.
oldest.
Yes. Yes. And he brought his blanket everywhere.
Yes, I love it. And now I know
Yeah.
Evelyn. And so your
Yes.
third child. And so, yeah. And it when I even look at your family, I see the glow of health. You guys taking care of yourselves shows, and that should matter for your clients.
Yes.
We can look at different advocates across the board, and you should be able to know, man, is this what their jam? Do they love this? And if you
Yes.
don't feel that, they're probably just going through the motions and maybe not who you need to be helping you. And so I love you're beaming when you talk about this. I love it.
Yeah.
All
Thank
right.
you.
And how do your services help women feel more in control of their birth experience and overall wellness?
So I think like I've spoken to this a little bit, but like nobody wants to be told what to do. Can we just start telling people like
Yeah.
your body is actually really well made and occasionally medical intervention is necessary. But if we like really hone in on our bodies and take good care of our bodies, they're going to do what they're supposed to do. So my like favorite thing to teach women is about oxytocin and how our bodies are beautifully designed with this positive feedback loop. So oxytocin starts flowing, your body's going into labor, and oxytocin, believe it or not, how funny is this? But also perfectly designed. It creates contractions to bring your baby out, and it's painful, but it also creates endorphins in your brain. So
Yes.
when we hone in on that and really allow like trust in our bodies,
Mhm.
man, what an experience. And my husband even said after our third, he said, so I guess we'll disclose this detail. We had her in the car, and I think you already know that. But for everybody else, we had her in the car. We did not make it to the hospital. I was just in my zone at home, and I was so in tune that when it did get really close and intense, it was kind of like, oh, darn it, we should have left sooner. We had to go now. And so after I had her, he said, people say, you pulled her up on your chest, you sat down in the car seat, and you looked like a psycho, like nothing happened. He said, you guys were the calmest, most peaceful picture. And that's how birth should be.
Yeah. Yeah.
She was calm. I was calm. The endorphin rush I felt was insane. There's
Yeah.
nothing to compare to it. So my favorite thing to teach and empower women is how amazing our bodies are. We
Oh,
are
absolutely.
extraordinarily made and built for
Yeah.
this.
Yeah.
And it just rolls right over into motherhood.
Yeah.
Like Evelyn lived on me for 9 months. I mean, she was in that wrap all the time.
Yeah.
And our oxytocin peaks when we snuggle our babies.
Yes.
We are
Yep.
divinely created for this. So I think that's how when you have somebody in your corner with the knowledge to back that, the physical presence to support that, and the encouragement to keep you grounded in that, it just is, it's a great relationship. So yeah.
Yeah, that's awesome. And I don't want to unpack this right now, but I want to, when you and I talk again, I want to, because do teach on the all the, things our body naturally does, the oxytocin, the endorphins, and how everything that happens in our body, even inflammation was designed for a purpose, but we're not supposed to stay in a state of inflammation, right? Inflammation tells a story. It
Yes.
shouldn't be where we live.
Right.
But what crossed my mind, and I took a note about this, and so I want to research, then you and I can talk again, is if we're getting poor nutrition and our brain is hijacked by processed foods,
Mhm.
is the oxytocin and the endorphins, are they doing their job?
Yeah.
And
Are they
that's
optimized?
scary. Yeah,
Yeah.
because they're probably not optimized. And so, that's really where nutrition comes in. We've always heard, oh, you can eat what you want because you're pregnant, and that is just not the case.
It's not.
We need to be eating to set up our pregnancy, the child's future,
Yes.
and the birth.
Yes.
And so that's another, you and I can talk about that.
Yes.
But do you have any client stories that really illustrate the transformation that can happen with the right support?
Yes. This is one of my favorite ones to share because I feel like when people hear birth doula, it is natural, crunchy granola. That's all
Yeah,
that I
yeah,
offer. And that's so not true. So I had a client who she knew that she might go without an epidural. It was her fourth baby, but she had had a horrific third baby experience where she walked in, got an epidural, nobody touched her for like 16 hours, and she made zero progress, zero change. She likely was not really in labor, maybe very early labor when she got there. So the intervention of the epidural and then no movement, she just sat there. So 54 hours later, she finally had her third baby. And her previous three babies had been malpositioned. So face presentation, where the face is coming out first,
Mhm.
it can really hurt the baby and it makes for a very long pushing process. So she had been through some trauma.
Okay.
So we sit down and we start going over what she wants, and she did a great job researching on her own, took a very great, it's Body Ready Method. It was the prenatal course that she took, fantastic for just getting her aware of what her body can do. But when we sat down and started talking about her birth plan, it wasn't so much, I will not take medication. It was about being heard and respected and included in her care. And so her birth was so empowering. And she ended up with an epidural, but she felt heard and
Yes.
she was respected. And they asked her and didn't tell her. And I, this was one of my first clients that I had, and I kind of walked away like, I hope I did a good job. I never like, and especially in the very beginning, you're still getting your footing. And she looked at me and she said, I could never have done that without you. And I looked at her like she was crazy. I'm like, but you did, like you could have. But the impact of having, she said, just having somebody in my corner
Yeah.
there supporting me. And even with, an epidural or whatever, she said that she was like, I am so proud of myself for going as far along as I did. I was surprised by what I could do. She advocated for not having Pitocin when she felt like her body was doing what it was supposed to, and she was right. It was doing great on her own. The provider looked at her at one point and said, how do you plan to push? Because she was in all fours. And just talking during transition, I'm like, get out of here. Like, why are you talking to her right now? And if anybody's had a natural labor, like, dude, I do not care how I'm pushing when I'm in transition. This baby's coming out one way or the other.
Yes.
Position is the last thing on my mind. But he started telling her, I recommend you push on your back. It's easier. And she looked at him and she said, easier for you. And I was like, oh my
I
gosh,
love
that was
it.
the best. Yes. And he looked stunned, deer in headlights. Like, she just said that. She certainly did say that
Yeah.
because it
Yeah.
is easier for you. It's not easier for her though. And
Yeah.
so I just really loved how she was able to speak up for herself. She fought induction at multiple appointments and even looped in her husband. And guess what? They stopped being so pushy once her husband was there. So just using those little tools, and
Yeah.
she now is breastfeeding longer than she's ever breastfed before. It's not easy for her, but she's working really hard at it. And she's had to advocate for some postpartum things that she was dealing with. And she's just, I feel like, entered a different space in the medical world. She's
Wow.
not okay, go with the flow every time. She's asking
Yeah.
questions.
Yeah.
And that's throughout her whole life, So
Yeah.
it was a great story. And I just loved, I think the biggest takeaway for me was it's not all about the details of the birth, epidural or no epidural, Pitocin or no Pitocin. It's more
Yeah.
about, are you seen, heard? Are you educated? Is it
Yeah.
your choice?
Yeah. Yeah. And you know that you just actually triggered a memory. Like I said earlier that, you remember every moment of delivery, but this wasn't at the forefront of my thought. So when I had my first, I pushed for hours and then they ended up giving me a spinal. And so he wouldn't crown. And so then after I had him, though, I was in recovery and I, couldn't feel anything because of the spinal. My mother was in there with me and I told her, I said, I think I'm hemorrhaging. I felt like a gush. And she
Mhm.
looked and she said, you just have urine flowing out of you. And so they cathed me and got a quart of urine. So
So
then
your bladder was in the way.
they knew this. Then the next two babies cathed me and the baby came out like that.
Your bladder sits in front of your baby's head.
Yeah.
Yeah.
So I had dozens of stitches in, and maybe all they needed to do was cath me the
Right.
first time.
Right. And that's where after being in deliveries like that, that's where I was said to myself, like, I need to wear a different hat because I'm in my mind using my nursing knowledge, like, they might just need to cath her, or have they checked her blood pressure? Because she looks really pale. And I feel trapped not to say anything because doulas are an unregulated profession. So here in the state of Wyoming, anybody can be a doula. And so I feel like it puts you in this corner. And I have a different knowledge. I have a different experience and a different ability to speak up for my clients. And so that's why I went down that other route. And that just made me think of that, just so I can say that, like, gather.
So what I just heard you say then, you're not the same as your average doula because you are also an RN with all this experience.
Correct. So when I enter the room, I do not introduce myself as the doula. I introduce myself as their independent patient advocate because it just holds a different authority. Doulas can definitely get a bad rap for speaking up and quote unquote overstepping, and I won't go down that path, but when you introduce yourself as their patient advocate, any conversation that I want to have with her when you the provider leave the room, I'm going to have right here because I have a HIPAA consent form signed with her. I have a patient advocate for consent or a contract signed with her. I can produce those and I can let you know that I am just as involved in her care as you are. And so, not in an intrusive way, but in we're partnering to make sure that she's taken care of to the best of your ability.
Okay, love that. So how do you integrate holistic practices with your medical background to offer comprehensive care?
Yeah, so so holistically, and I'm learning more about this all the time. So like nutrition is a big focus right now. And I know that you and I have talked about collaborating on that. But there are so many ways to prepare our bodies for labor. And like that client that I had, she had 3 malpositioned babies. So we worked our butts off to stretch and loosen ligaments and give room and space where it's needed. I created a printout with all these positions for her to do, stretches, etc., almost daily to keep her baby in an optimal position. She did not have a face presentation baby this time, so she was very excited about that. There are so many things that we can do, and I learned those things on the nursing front. So there's positioning, stretching, acupuncture, nutrition. There are certain things that you can eat and drink, like dates and red raspberry leaf tea, that facilitate a softer cervix. So even if you're getting induced, you can help your body along.
Yes.
There's curb walking. And let's see, I wrote some notes down, so I want to make sure I don't forget anything. Your environment. How do we maximize oxytocin production? What does your body need to produce the most oxytocin? I look back at my first labor and I'm just like, oh my gosh, it was like an oxytocin wall. I mean, nothing I did in my environment was helping my oxytocin flow. So shockingly, I needed tons of Pitocin, right? So I'm teaching people how to maximize and optimize what our bodies are so good at doing. And then, so those are like the holistic things. Then my medical background really comes in when, I'm seeing a client and maybe something does feel a little off to her. So I'm like racking, my nursing brain is binging, like, okay, we might need to look into this, this, and this. So I might ask her, like, have you asked your provider about that? What did they say? Or making sure that, because I've worked at so many hospitals, it gave me a great idea as to how different things can be, different policies and procedures you might see. So I actually had a client recently who wants a VBAC really bad. And that's a vaginal birth after cesarean for anybody who doesn't know. And I encouraged her to get, or I can do it for her hospital that she plans to birth at, their policies on VBAC. Are they supportive of a successful VBAC? Because if they have a ton of policies in place that are like roadblocks, we're probably going to end up back in a repeat C-section, or if your provider feels really strongly about inducing you as a VBAC, that's not the best way to facilitate a successful VBAC. So asking them those questions now, and that's something that's super beneficial, is that with my knowledge, I know to ask for those things.
Okay. Yeah. No, that's huge. And so let's see. What's your approach to supporting not just the physical birth, but also the emotional and spiritual journey of motherhood?
Yeah, I think just being their friend first and foremost. I'm your friend.
Yeah.
I'm
Yeah.
always here to talk and like go through things with you and kind of hash
Yeah.
things out.
Yeah.
Also, I do mindset work and I can always refer out if I feel like it's necessary. Some people carry some like serious trauma from birth, and maybe it's a previous birth that they just need more than I can offer. And I have a couple resources in town that I refer out to, but I try to start with like writing, rewriting the birth story. Where does it get sticky? Where does fear pop in? And then going through either whatever speaks to the client. Like some people just want to hear more positive birth stories and they can kind of work out of that. I have one client who really likes medical data. So we go through like, okay, what's the chances of that happening again? Like let's talk real statistics here.
Yeah.
You
Yeah.
know, or so all those things. So that's kind of how I work mindset. Mindset is probably the majority of the work I do, really. You
Yeah.
know, your mindset going into labor is extremely important. And then spiritual journey, I am a Christian woman. And
Yeah.
if you want to talk God at the center of your birth, I'm your girl all day long.
Yeah.
But it's whatever speaks to my clients. So
Yeah.
I do hold a special place for women who are in that space because that's what helped me so much. So
Yeah.
yeah.
No, I love that. And I love that you said you become a friend. So your patients are not a number. And that's what I work on as well. My clients will even hear me say, if I can't get to know you well and make this personal, one, I can't help you. Two, I don't want to do this anymore. What you're doing is really, really personal. And
Yes.
yeah, and to gain the level of trust, you become friends. That matters. So I love that even said that you become friends. So you kind of touched on this question, but I want to ask it in case we missed something. But how do you support women who may have experienced trauma, fear, or medical mistrust?
Yeah, so I wrote down some like specific things that I do. One is like a big advocacy session. So we will do like role play and I will pretend to be the doctor and we will practice because I can't be there speaking for them during like the throes of labor. Sure, yes. And even in a medical room, if I'm in an appointment, bouncing off my ideas, yes. But that doesn't help them long term. What helps them long term is finding their own voice. So, talking about like the doctor is just another person in your life. And so, when they say this, let's practice saying no or stating what you want from this. So, I have like advocacy tools I use, as simple as saying no to as complex as saying, something along the lines of, I can tell that you feel very uncomfortable with my choices. I'm letting you know that I've done a lot of research about this. And if you would like to print out the study that you're referencing, I would look into it. Really honing in on statements that give you some authority in that room because it can be very intimidating. It's intimidating for me when I'm the patient and this is like my world.
Yeah.
It can still be intimidating.
Yeah.
So that's how I use like medical mistrust. That's usually what I do there. With trauma or fear of trauma, I always try to make sure that once the client and I have talked about it, and if we're in a good place, we're walking into birth, I always discuss like, if it's something that's going to impact your birth, how comfortable are you looping in the rest of your team? The more people know where you're coming from, the better they can support you in that.
Yeah.
So if they're comfortable with it, I always like to loop in the rest of their medical team. And then we use like writing, visualization, positive birth stories, and then, like I said, referring out if necessary.
Okay. Nice, nice. I like that. And then I like how this resonated with me because you said, you ask them to print out the study so that you can look into it. And I do that as well because, people will bring these ideas to you and sometimes they're from influencers or a YouTube video or something that they've seen no science. They've seen
Yeah,
no data, or if they saw it, they don't know how to unpack it. And
right.
so that is huge that you even bring that to the forefront. Bring that to me and let me look at it and then even explain it.
Right. And I actually said that to a provider when I was pregnant with Evelyn. I was 37 when I was pregnant with her. He wanted to do like, I think NST tests before every appointment, and I just didn't feel like it was necessary. And he said, I asked why, and he said, because my blood vessels were old. And I just looked at him like, so I said, well, could you print out the study that supports that?
Yeah.
And guess what? I never got anything. So we
No.
just moved on, and he stopped asking me about it. So
Yeah.
it kind of helps.
Yeah. That's, yeah, crazy. And so you might have touched a little on this as well, but what does an empowered birth look like to you, and how do you help your clients achieve that?
It's information, fully informed choices. And it's from prenatal appointments, education, information, walking into birth prepared. And then if necessary in the room, I have no problem having a hard stop. You know, hold on a second, this is getting derailed, or she's being coerced into something, and I will absolutely step in, but it doesn't typically get there.
Okay.
Yeah, so mostly information and preparation.
So do you think that even you being there as an advocate kind of is why it doesn't get there?
Absolutely.
Yeah.
Once they hear independent RN patient advocate, and I hate to say this because it's not the kind of person I am, but they immediately are looking at how I be sued in this
Yeah.
situation, because somebody with knowledge who's a third party observer to your
Yeah.
actions, not there to intimidate medical personnel or to make it difficult. I'm there to support my client and ensure that they are taken care of, respected, and that their patient rights are
Yeah.
upheld.
Yeah.
And so I have no problem speaking up and saying, hang on
Yeah.
a second, this isn't quite what she wants.
Yeah.
So
Yeah.
it does
No.
change the tone.
Yeah, I kind of figured. I mean, and it's just where even and I know in hospitals that's always like the fear of being sued. And but even in just the human brain, if like say a woman going for a walk by herself or two women going for a walk are less likely to be attacked than one woman, because when there's an extra person there,
Yes,
it changes the scenario.
it does.
So yeah,
Even
okay.
at appointments. So huge recommendation for anybody out there. Bring somebody with you to your appointments.
Yeah.
Always. Just
Yeah.
bring somebody.
Yeah.
Husband, friend, whoever.
Yeah. my husband and I have always gone to our doctor appointments together, and I joke and say it's because I won't get all the information from my 5-year-old. My husband is my
Yeah,
consummate 5-year-old, and I won't get all the information from him if I'm not there. But
true.
it does matter. I feel like you're treated different when somebody that cares is there.
Yes, I agree.
No.
Yeah.
Okay. So if you could change one thing about the way our system treats women in birth, what would it be?
Treating our bodies like they're broken. I wish that if everybody could just approach birth with the belief that it's going to be good and go well and that we were made for this, and then intervene when it's not,
Yeah.
that I just would make a world of difference. After I had Evelyn in the car, my body did what it was supposed to, right? Everything went beautifully.
Yeah.
Do I desire to have another baby in the car? No, but nothing went wrong. Everything went great. And their solution, so to speak, solution to a problem I didn't even know I had was that if I was going to have any more kids, we better induce you. So you want to pull
Yeah.
my baby out before they're ready because my
Yeah.
body did such a good job of doing it. So
Right.
I was shocked. I had speechless. I was like, that won't happen.
So I had my third in 20 minutes after I got to the hospital.
Yeah.
And and thinking back, so I remember getting up at like, I don't know, 2 or 3 a.m. I don't remember that clearly, but I woke up knowing I was having contractions, but I was so tired and I was trying to time them and I kept falling back to sleep.
Yeah.
So my body was just doing its thing. Well, then I finally woke up in a hard contraction, looked, and they were like less than a minute apart.
Yeah.
And I was like, we got to move. And so we
Yeah.
get to the hospital, had her in 20 minutes, and I was having a tubal ligation the next day.
Okay.
But the doctor even said, if you weren't having a tubal ligation, we would handle this differently next time because you'd never make it to the hospital. So that's probably what they would have done, is induce early if I
Yeah.
was going to have another child.
But how sad, right? Because the initiation of labor comes from fetal lung development.
Yeah.
So like we're just going to ignore that and induce so that we can have total control over this.
Yeah.
Surrender it and support it.
Yeah. Yeah.
Yeah, it's just
No,
crazy.
you're opening my eyes a lot even to my own
Yeah.
situation. And even in nutrition, in the health world that I'm, an advocate in, they treat people's bodies like they're broken. And well, and so here's the thing, on the cellular level, they are broken, but we can fix it. But what
Right.
they'd want to do is just medicate it and put a Band-Aid on
Yes, we mask it
it.
and
Hmm.
all get worse. Our habits get worse.
Yeah.
So
Yeah.
like women in pregnancy, right? I had some high blood pressure at the very end of my first pregnancy. Nobody talked to me about nutrition. And then with my second pregnancy, I had it again. With my third, I was committed. Let's see, I had a 5 year gap. So I had had 5 years, solid labor and delivery experience. And I was like, no, I am committed. It's always just this borderline high blood pressure, but I get induced for it and I get all these interventions. I don't want that. I want
Yeah.
my baby, my body to do what it's supposed to do. And guess what? I changed my nutrition and I didn't have high blood pressure. Is that going to be everybody? No. But
Right. Right.
let's start there. That's an
Right.
easy place to start.
Yeah, definitely.
Yeah.
Definitely. So, what is your vision for your practice and the impact you hope to have on women and families in your community? I
Oh
should
man.
say in our community, because you're in my
Yeah.
community.
Our community. So, okay, so my vision, short term right now, supporting women the way that I am. I have 3 young children, and so slow and steady is the name of my game right now while they're little and they need me a lot. Um, but it's kind of beautiful because I get to grow really organic, rushed or like forcing. My next project I'm working on is I'm signing up to be a board certified patient advocate. That is where you actually take a test and you're considered board certified. It just opens up the resources. So I'll be taking a couple, let's see, it's in the fall. And then after board certification, I'm going to work diligently on a childbirth education course that focuses on advocacy. So you're going to get all the physiological childbirth and all your options. I'm going to tell you everything that's out there to you in the hospital. And I'm also going to speak to advocacy on every level. How do we handle this situation when you walk in and you're told this? Where do you find studies? How do you support yourself? What statements can you use down to the nitty-gritty of how we talk to our providers and researching the stuff that I research from clients, right? Like the hospital, their policies, where do you get that stuff? So that's my big goal within a year. I would love to have my childbirth education course available to anybody. It'll be an online course, but then I'm also available as an advocate. I don't do any virtual doula services. I just don't feel like it works. I think we got forced into that during COVID, but I am on doula. So, but if you're far away and you want my services, I can absolutely be your advocate virtually. So.
Nice. No, this has been very eye-opening to me and brought back memories and questions I have. And like I said, we're going to talk again. And I've already mentioned maybe having you with a successful client. I would love the three-way interview and hear the stories from another perspective. And
Yeah.
I have a nutrition client that had a horrific story having with the hospital. And so I would also love the three of us to come on and talk about that. So, friends, this is not the last time you're seeing Ashlee.
Yeah.
And I really want to thank you for being here. And her information is above and below this video. So, and if you can't reach her, reach out to me and I will get you to her. But her URL is Affirming Birth, AFFIRMING birth, BIRTH.com. And Ashlee, I loved this. This was great. Thank you.
Thank you. Thank you, Marcy.